Hey, what's up? Dr. Taylor, Aspire Chiropractic. Had a lot of hip stuff coming in recently. And a couple different things. Number one, whether it's your hip, your neck, your shoulder, your low back, your knee, your whatever. Whatever it is that you've got coming in here, more often than not, you're going to come in here and you're going to tell me 1, 2, or 3 things that are going on. I got this neck thing, I got this shoulder thing, I got this hip thing. This applies to everything, but it really applies to the hip. I'm going to tell you right now, your thing is never one thing, okay? This whole thing, it's all connected, right? I hope that's not new information, but this thing is all connected. So you come in, if you got a thing that you want me to check out, odds are I'm going to find more things, especially if we're dealing with the hip, okay? The hip is complicated, to say the least. So, what do we got here? It looks like 2 praying mantises that are crying. This is the hip. This is the lumbopelvic hip complex, if you will. This one here, this is from the front. This one here, this is from the back, okay? So, come in. Doc, I got this hip thing going on. I got this pain right here. I've got something like in the crease, something kind of like that. This is just going to be an overview to really, hopefully, no pun intended, illustrate that it is never one thing. Now, it's never one thing, but there's always one thing involved in every hip case, okay? And this is going to be from the front. It's a muscle called your psoas. If you are in any way, shape, or form semi-familiar with working out or with the gym, you've heard of the psoas, okay? So if we're looking from the front, the psoas connects to the last 4 or 5 lumbar vertebrae, and it goes forward and down right into the crease of your hip. Now the psoas doesn't work alone, just like all these other muscles, but the psoas 100% of the time also works with another muscle called the iliacus or the ilius, which attaches to the top part of the inside of the crest of your hip. So remember, we've got all our guts and stuff here, but we've got one muscle here, and then we've got another one here that attaches to all the lumbar vertebrae, and they're kind of divided, they're kind of joined together, they kind of do the same thing. You got to remember, muscles only pull, right? Your bicep pulls, your tricep pulls. When this thing pulls, it's going to do one of 2 things. Either A, it's going to flex the hip, it's going to bring it up, or B, it's going to bring the trunk forward, right? Because you're either pulling the lumbar spine down or you're pulling the leg up. But as you can see, especially with the psoas, we're crossing the joints of all 5 of the lumbar vertebrae. We're crossing the SI joint here on the inside, and we're crossing the hip joint. Doc, I got this hip thing. Okay, let's unpack this. So we've got that going on there. We've also, again, from the front here, we've got our quad. Our quad is called the quad because it's actually 4 separate muscles. One of them attaches up here in the front of the pelvis, goes down. You can see it crosses that joint and it crosses the knee joint. And then there are other muscles in the quad that are in there also. And then there's another one. Again, from the front here, we'll go over to this side. It's your adductors, adductors, add, bring together. So again, front of the pelvis, so we're talking like right in here in the hip joint, in the crease, goes down and attaches into the inside of your thigh. So all of these muscles together will do this in one way, shape, or form. Now, here's the thing. The hip, this thing has 360 degrees of motion, right? Ideally, more or less. This thing can move all over the place, 360. So, if you go straight up, you're using more of one muscle. If you're kind of going out to the side, you're using more of a different muscle. Let's take this thing, let's turn it around. Now we're looking at you from behind. We've got the big one that we're all aware of. It's called our glute, right? Attaches in here in your hip and your SI. Comes down, and what's it do? It extends the lower leg. Probably more common for women than men, but if you are taking this picture in the gym, because this is a normal stance, you're flexing your glute, right? You've also got a bunch of little ones here out to the side, kind of come in like that. You've got another one kind of come down like that. This thing here, this guy sucks. This is called your piriformis. My red marker's going out. It's called your piriformis here, and what it does is an external rotator of the hip. Now, why that muscle is so important and so problematic is because here, if we're looking from behind, remember, we've got all of our nerves that exit the spine. These ones down here, They come out individually, they come together, and they form a big fat nerve called your sciatic nerve. We've all heard of sciatica, maybe, probably. Now this nerve travels underneath that piriformis muscle. So if that muscle gets pissed, it pinches that sciatic nerve. And you come in here, doc, I've got a pain in my ass, literally, running down into the lower leg, or into the leg, possibly into the lower leg. Little rule of thumb, the further down the pain goes, the bigger the problem is, the longer it's going to take to fix it. So if we've got the back of the leg here, we turn it over, we flip it on top of that. Doc, I've got a hip problem. We're going to call this guy right here. Let's say we're doing this hip, which is also this hip because we turned it around. I've got a hip problem. Okay, where's your hip problem? It's kind of right in here. Okay, cool. We're going to assess that joint, the SI joint, the sacroiliac joint. But we've also got all of these different muscles to deal with that are contending with the issue. Let alone, shoot, like if we're getting in there, there are a whole bunch of tiny little muscles right in through here. Fine movers, if you will, maybe a little tweak, little bend, little twist that are working with that also. General rule of thumb, there are like, don't quote, give or take, there are 21 different muscles that cross each hip joint. And some of those muscles, we got to remember, cross other joints as well. So doc, I've got a hip problem. Okay, like I said, let's unpack this thing. Where do you feel it? It's in the front, in the crease. Okay, cool. So we're thinking psoas, things like that. It's in the back. It's kind of in the meat, if you will. Okay, well, let's turn this thing around. We'll assess that SI joint. Let's see how your piriformis is doing. That's probably going to light up really good. Or heck, do we have any of these adductors on the inside? Or abductors? Well, remember that in chiropractic school? To be abducted, taken by aliens, you take away, right? So abduction means to take away. Doc, I've got a hip problem. Okay, crap. There's a lot of stuff we got to cover. Let alone, if we're going to kind of go down this rabbit hole with which hips we need to. We need to assess the knee. We need to assess the ankle and foot. Because again, this thing here, 360 degrees of motion, can move all over the place. Same thing with the ankle. We've all rolled our ankle in one way or another. That's got 360 degrees of motion. What's your knee do? Your knee does one thing. Bends up and down. That's it. Like it literally just does this. You can't see it. It's out of frame of the camera, but I'm doing this with my knee. So if you've got a problem in any direction with the hip or the ankle, other than straight up and down, knee can't really compensate, right? So, doc, I got a hip problem. Or, doc, I got a knee problem. Okay, cool. We're going to check your knee, but we're also going to check your hip, and we're going to check your ankle. Knee feels fine. Knee's moving good. Muscle tests show clear. Ankle, kind of screwed up. Man, your hip is a mess. Or, more often than not, your low back is a mess. So your low back's a mess. Screws with that muscle there, that's psoas. So we're crossing 1, 2, 3, 4, 5 joints in the low back, 6 with the SI joint, 7 if we're getting the hip involved. And if that issue is in any degree other than straight up and down, even if we got a little bit of a change in vector going on there, something kind of like that, your knee can't compensate. So you'll come in, doc, I've got a knee problem. And then I got to break it to you that, I believe you have pain in your knee, but that's not the source of the issue. The source of the issue is your low back, because that's screwing with your psoas. And also the fact that you have a 40-hour a week job, so you're sitting all the time. And also your shoes suck. So your poor little knee here, my knee, your poor little knee here can't compensate for all the mess you've got going on above and below it. But you come in here and you blame the knee. The poor knee. Your knee problem is not a knee problem. Your knee is a hip, a low back, or an ankle problem, unless it truly is a knee problem. So, just kind of a little overview. You've had a lot of these walking into the office today. My hip hurts. Okay, perfect. Well, let's assess this. Okay, your SI joint is kind of screwed up. Okay, adductor is tight. We lack a whole lot of external rotation. You've got this nasty trigger point right here, right in your piriformis muscle. That's what's pinching on your sciatic nerve, causing that numbness and tingling going down your leg. There's your hip problem. So, best case scenario about this, you came to the right place because I fix this stuff all the time. Worst case scenario though, odds are you probably waited a long time. So then we come in with that knee issue. The knee issue is just the newest issue. But if we retrace it, we go backwards, then you tell me, oh, actually about 2 months ago I rolled my ankle. Man, and you know what, in all reality, a few months before that, I was hooping it up with the boys, if you will, and I tweaked my low back because I went up for a layup, but I did it backwards, where I brought the right leg and the left knee. Came down awkward. I got a hip problem. Cool. We fix hip problems. And when we do that, we fix knee problems, we fix ankle problems, and we fix low back problems. We see more of this stuff in a morning than your regular doctor does probably in a month. So, if any of these issues sound familiar or sound like something somebody at the office has been complaining about, somebody in your family's been complaining about, just give us a buzz or walk right in. We're ready to help you right here at Aspire Chiropractic when you're ready to be your best. Naturally.